treat today to be able to talk to Dr. Amy Haas. Amy is a real gift to the profession. We've seen her name on a number of case reports and hypothesis papers. She's a bit of a mover and shaker in the world of heart rate variability. But we're here to talk about a different topic today. Dr. Amy, as a chiropractor, is a person who deals in the brain and central nervous system. But what happens when an expert on such a system receives a little bit of a curveball and has to deal with an insult to the brain?
It's been a hell of a year.
Yeah.
It's been a real journey, and it has been a firsthand indoctrination into what many of our patients go through that helps me understand at a very different level what the needs of people are when they've been afflicted with a concussion or post-concussive syndrome. What happened was I have had history of a couple of vasovagal episodes. So I know what they feel like. I know when they're happening.
Yeah.
And that particular evening, I was up in Maine with a couple of friends, and I had had a burger the day before that I was pretty sure wasn't good. Went to sleep, and at 2 a.m., I woke up to a very intense pain in my abdomen, and my body told me in no uncertain terms it was time to get up. I was at the sink, and I washed my hands, and I went and reached for the doorknob to exit the bathroom. And then I knew something did not feel right. And I remember thinking to myself, Amy, you know what's happening. Get on the floor. I actually squatted down halfway to the floor and almost got on the floor. And then I'm like, no, couldn't possibly be. I'm fine. And I woke up about 15 minutes later in multiple pools of blood. Apparently what happened is, from the crouch position on the floor, I decided in my right state of mind that it was a good idea to stand up, and I broke my nose on the door jamb, which who knows exactly how this happened because I don't remember. Let me take a minute and describe to you the impact of my cranium, my orofacial cranium on the floor, because this is enough to give any chiropractor chills. When I woke up, I had no other injuries on my body except a very mild bruise on my knee, which told me I'd basically gone from full up to splat on the ground. And the only place that hit was right here. So what you've got, when you look at that from the side, if I hit this way, I have shear force to the craniocervical junction.
Right.
And all the chiropractors out there are going, oh, yeah, that's no bueno. That certainly explains some of the ever so funky symptoms that I ended up with. I chose to not have traditional treatment. Rationale for this, which is kind of hilarious unto itself, because when you have a head injury, you shouldn't listen to your own rationale.
Yeah.
My rationale on this was, okay, I'm with two other people. One of them is also a chiropractor, and we are, I have balance is fine, cognition is fine, verbal is fine. I'm not having any drooping on one side of my, except the paralysis right here, but we won't talk about that. And we just decided we were going to wait to seek emergency treatment. Part of it was because we were in rural Maine. At 3 o'clock on a Sunday morning in rural Maine, you're not going to find a lot. The other reason is that the typical protocol for someone when they've hit their head is going to be, CAT scan, MRI, and I reasoned that if nothing changed in terms of my neurological presentation, there was no actual reason to do that. One of the best lessons that I learned when I was a postdoc at Harvard is never do an experiment just to see. Only do an experiment if it is going to dictate your next move. My next move was not going to be changed as long as my neurological presentation was stable. So it was kind of a sketchy move, and it's not something that I would recommend to anybody. It was, okay, I'll admit it. It was flagrantly, blatantly stupid of me. And what happened in the next month and a half was a really formative experience in how I think about brain health. I had all sorts of funky symptoms. Some of them were physical, some of them were more mental health related. The
Mhm.
physical symptoms, I had some difficulty gripping with one hand. There was no hand injury. That's a
Mhm.
brain injury. The funniest one was when I was typing. I was trying to I was working on a grant for the ASRF that I actually had to abandon because I couldn't complete sentences.
Mhm.
Um, I was typing, and my right hand would type the word correctly. My left hand would type gibberish.
Wow, that's so weird.
It was really weird, and the weirdest thing is it was reproducible.
Uh,
Because of course I'm a scientist, so I'm going to say, is this, reproducible? You can look back at pictures and you can see that there's the signs of a brainstem difficulty. I had paralysis of my upper lip, nerve damage here, and then I had my eye was bulging on this side, and I had a little bit of loss. It was, yeah. So there was a hit to the head.
yeah. Mhm.
In the coming weeks, I had some of what you would expect, some of what you wouldn't, because it was a non-traditional concussion. I didn't hit the side of my head.
Yeah.
I didn't have any headaches, which was good.
Yeah.
That's a good prognostic indicator.
Mhm.
But I did have a couple of interesting changes that I thought personally were absolutely fascinating. One of which was my heart rate variability nosedive.
Wow. And for a heart rate variability geek, you'd go, that's interesting.
The universe was like, hey, Amy, you want to study something? Here's an example. Thank you, universe. Really, I appreciate the learning opportunity. Um, yeah. So HRV is something that is highly sensitive. It's a multi-sensory integration metric of different things that are being integrated in your brainstem and in your brain.
Yeah.
And mine did all sorts of interesting things. It's since recovered. It's fine because the body has an amazing capacity to heal. Thank goodness. Um, a couple of heart palpitations, and that is not unexpected
Mhm.
given brainstem. Um, and also, I was having panic attacks
Yeah. Wow.
and anxiety out the roof.
Right.
Um, some of those were very difficult to deal with,
Yeah.
and it whole different empathy for people in my practice who deal with that.
Yeah.
Anxiety is a neurochemical phenomenon.
Yeah. Yeah.
Change your brain chemistry, you're going to have an output.
Mhm.
So it was, I did the best I could with anti-inflammatories, not chemical, but rather omega-3s, curcumin,
Mhm.
and phosphatidylinositol, a lot of good supplemental support to try
Yeah.
to keep the brain in a healing state. And yet, one of the things that I'm aware of, as this is an area of interest to me, that I think has a lot of relevance to me and to our field, is the connections between the lymphatic system,
Mhm.
which enacts repair in the brain, and the CNS lymphatic system and
Strange.
the upper cervical spine.
Yeah.
So it was
Ah.
almost, the whole paper, the hypothesis paper that I wrote was a discussion of how an upper cervical subluxation or an upper cervical injury, how it could inhibit cranial, intracranial fluid dynamics and drainage of waste products from healing brain tissue. So again, thanks universe. I really appreciate the opportunity to learn more.
Gosh. Gosh.
And
So
so it's
you've had effects with language. You've had effects with one side of your, one hand forming like it should and the other not.
yeah,
You've had paralysis in the face. You've had,
yep.
um, and you've had mood and
Cranial
anxiety.
trauma.
Yeah.
And the balance issues, but those I just found those humorous. I just thought it was funny. I'm like, I'm a regular yoga practitioner, so I know when if I can't hold tree pose, there's something wrong. And I was going into
Falling tree.
falling tree.
Yeah.
I was going into a couple of the poses, just the real basic poses, and I couldn't find my proprioceptive sense of where I was, and I'm like, oh yeah, brain
Yeah.
injury.
Yeah.
Yeah.
So this has obviously taken you further into a lived understanding and a deeper empathy for the kind of challenges that your patients might have.
Mm-hmm. Yeah.
How has it impacted your practice as a chiropractor?
I am so thankful for the resources that I had at my disposal, and this has really helped me to clarify a passion that I have for sharing knowledge with others and helping to inspire people to know what their resources are.
Yeah.
Had I not already known about the possibility of craniosacral therapy, specifically cranial work,
Yeah.
I would have had access to the amazing work that was done by a couple of friends of mine, John Mark and Linda Slack, who literally remolded my face.
Wow.
Yeah, I have before and after pictures that blow your mind.
Yeah.
And that demonstrated to me that yes, cranial bones absolutely, unquestionably do move.
Yeah. Wow.
I shifted my nose back into place. So when you think about that in terms of all the kids who have sports injuries, if they don't know that that's possible, then they're never going to access that form of care. So it's up to us to talk about it and say, hey, the cranial bones fit together like a three-dimensional puzzle, and an injury can distort them. So a specific work by practitioners who are trained to do this work can gently help to release the tension and the torsion on the cranial bones. And that's really important because the cranium is the seat for the brain. A second thing that was very informative to me was how my body responded to adjustments after and in the course of time after the injury. I am a big proponent of select the technique for the person. I'm not a big fan of the dogmatic, it must be this technique, it must be this technique, everybody else is wrong.
Yeah.
Because we really, there's more than one way to skin a cat. And we should really be thinking about the cat rather than the kitchen implements. We should think about our common ground. So, whatever someone uses to address vertebral subluxation complex really should be selected for the patient in their unique circumstance. In my particular circumstance, let's just say this is not my first concussion.
Okay. But perhaps if you can, in terms of recovery time.
This one, I'm hoping this is my last concussion because, oh my God, I've had a couple. I had a mountain biking accident. I had an ice climbing accident. I mean, I'm an outdoor athlete, so I bashed the crap out of my body, and that's just life.
Yeah.
Turns out that with multiple concussions, the prognosis is indeed different because you have, it's like you've sprained your ankle once, then you sprain your ankle 3 times, your ankle is weakened. The same can be said for the articulations and ligaments and the entire structure that is the upper cervical spine.
Yeah. Okay.
Once you add a couple of accidents, you need to treat that area a little bit. You need to address that area a little bit differently than you would a structure that has no compromise.
Yeah.
My experience with that is I started getting really dizzy after my adjustments. And that was unusual. And for me, that's an interesting informative piece because that's a piece of clinical experiential evidence that now makes me watch my patients and say, hey, if they get dizzy after an adjustment, that may have been too much force. It may be time to switch to a different technique or, to toggle, to activator, to craniosacral, to whatever suits the patient. So I've had a couple of different upper cervical techniques that I've had utilized on myself. And one of them in particular has been, pun intended, mind-boggling. I knew I was getting better when my prefrontal cortex sense of humor started to come back. I'm like, there it is.
There's the puns. We found them.
It's the brainiac humor and the quick wit that was gone.
Yeah,
absolutely gone.
I remember speaking to you just in the wake of all of this, and I don't think at that point you were letting on really how much it was impacting you. But I remember you look different now. And I remember, your humor had kind of gone flat a little bit for a while.
Yeah. So you noted that in our conversations. And some of the things that I was experiencing, what I believe was the reduced drainage of metabolic byproducts from healing in the brain, just because of the diffuse, swelling associated with a brain injury. What I experienced was difficulty finding words, difficulty finding the right words, difficulty finishing sentences in some cases. And I was also preparing my talks for Mile High and Axiom. So there are times in life when you literally just have to say, I'm going to take this one step at a time. I am well supported by my friends and family around here who know what's going on. There's no reason to really share this with many other people. Yeah, there's some scary stuff going on. And yeah, I have to monitor myself because there's a clear chance of a subdural hematoma. And that could be a big problem. Thankfully, I did not have one. Someone who graduated from Life University just prior to when I did had the same injury as me.
Yeah.
And he did, and he passed away.
Oh.
So
wow.
I'm pretty lucky to be here.
Yeah.
Apparently the universe still wants me here, and
wow.
apparently I have plenty of more things to learn.
Okay.
Yeah, it's been a rough patch. But you land on your feet and you walk forward.
Yeah.
And then you use the opportunity to learn more and use your experience to help other people.
Yeah.
So in the experience that I have had, it is very, very clear to me that when someone has had a neck trauma, whiplash equals concussion, concussion equals whiplash. You really, in terms of physics, can't have one without the other. It's a bruise to the brain tissue. It's just how it works. And when a person has that, you may have a compromise to the brain that runs the whole body, and you can see reflections of that. You can observe objectively reflections of that, such as heart rate variability, sleep anxiety, balance, and many different physical functions. And conversely, you can also follow those as someone improves with time when you have selected the appropriate technique to address the problem. And that's what I've been able to do. The upper cervical adjustments, the Blair adjustments, have been wonderful.
Yeah.
I can't even express to you what it feels like to have an adjustment and feel your brain drain.
It's just so interesting to see inside this from a clinical perspective. I mean, when we're looking at those patients that have repetitive concussions, or the athletes, or and it makes you even look at anxiety a little bit different, I suppose. And
oh my gosh, one of the things we should be thinking about when kiddos are coming in with anxiety, one of the things we should be thinking about is, okay, have you had a concussion? Have you had a head injury that may have resulted in a concussion that you were never diagnosed with?
Yeah.
And one of the things that I'm starting to feel very strongly about is that we as chiropractors, we can have whatever techniques we want, all the tools in the kitchen. But one of the things that really should be in every chiropractor's toolkit is a very specific analysis and a way to address the upper cervical spine. I think that's something all of us really should take the time to learn, because the value of that is pretty big to everybody around.
Yeah.
Whether it's the kid who's fallen out of the cradle, because they do.
Oh,
the kid that falls off of the swing set, because they do. The kid that takes a hit with a softball, because they do. The kid that falls off the bike and hits their head. Any of these things can completely change the trajectory of a child's life.
Yeah. Wow.
If the brain doesn't heal because the appropriate upper cervical adjustment has not cleared the subluxation that was resulting from the accident, if that never clears, the kid's life is compromised. It's as simple as that. Or we could even talk about birth trauma, but we're not supposed to go there. There are different fields of research that have clearly shown that compromise at the cranial cervical junction can instigate reduced drainage via the internal jugular vein. That's not chiropractic, that is in the medical research. The medical research has shown a lot of different pieces of the puzzle with respect to fluid exchange to and from the cranium.
Mm-hmm.
But so the research evidence has not coalesced in a picture that gives us a precise cause, effect, and predictability at this point. That said, the clinical experiential evidence absolutely is.
Yeah,
We as chiropractors have seen children who come in with neck injuries and concussions. They have the headaches, anxiety, visual disturbances, and we adjust them to correct their subluxations and they get better. What would happen if they were never adjusted?
Mm.
There's plenty of case studies following the resolution of XYZ with application of chiropractic care after a traumatic incident, or after improper healing from a traumatic incident. There's plenty of case studies out there.
Yeah, and I've noticed a few of them pop up in the Journal of Contemporary Chiropractic, which is journal.parker.edu. So there's some new ones there for people to go and check out. We should probably wind up this interview, even though we could keep on talking about it for ages. But I think the interesting thing here is the lived experience when you're actually observing the brain through the recovery of trauma. Not every concussion is going to just get better overnight. Not every presentation of anxiety is going to be unrelated to a brain trauma, or some of these other things that we might be seeing. It takes us deeper into a bit of empathy for our patients, but also deeper into an understanding of just how important it is to make sure that the upper cervical spine is free of subluxations, among other things. So
that people have access to the resources that they may need.
Yeah.
Every parent should know where their dentist is, where their pediatrician is, and where the emergency services is, and where chiropractor is, and when to use each one of them.
Yeah, absolutely. Thank you, Dr. Amy. And we will be able to hear from Dr. Amy at the Lyceum coming up. Is it the Sherman Lyceum?
Palmer Lyceum in Iowa on August 8th and 9th. And I'm very honored to be a part of a great crew of, I think there's about 15 speakers. And I'm going to be speaking on the big puzzle. And that is the connection between neurophysiology, adaptability, vertebral subluxation complex, and the specific chiropractic adjustment according to dynamical systems biology.
Wow.
I guess that just sounded like a bunch of big words, but I'm going to have some fun.
But that's a little bit of evidence that you can get through complex sentences again. So, that's nice. I know that there's going to be a lot we'll see from Dr. Amy in the future. I find it a bit ironic that the universe seems to have gifted you with this experience of heart rate variability and glymphatic drainage and all of those things through the lens of concussion. Can't wait to see what you do with these learnings. Thank you, Dr. Amy.
Thanks for having me. It's always a pleasure to talk with you.